How about Minnie? Do you like Minnie? Do you like Minnie? Do you like Minnie? She's up here. We're looking at the movement of the eye. Oh, where's her shoes? Where's her shoes? See if the eyes can cross. Good job. We check the alignment of the eyes. Peekaboo, peekaboo. There, you got her, you got her. We also use lights to check the prescription of the eyes. Where is it now? Here are some common eye problems in babies that you may see at the beginning that you shouldn't be too worried about. One condition is called nasal lacrimal duct obstruction. In our eyelids, we have a tiny little pore here in the corner of our eyelid that drains our tears. When babies are born, sometimes that duct is not open, so the tears have nowhere to drain and the tears just spill out of the eye. You may notice this in your baby if you have one eye that's very watery or that's constantly crying, or when the babies cry, it seems like the tears stay in the eye and it doesn't dry up. Now this is pretty common and usually self-resolves between the first year of life. So things that you can do as the parent is you can give a gentle massage just in this area to see if you can help the duct open over time. Worst case scenario, if the duct does not open on itself, there is a small surgical procedure that can be done to open up the passageway. Signs of regular tearing will usually be just clear liquid. It'll look kind of like, tears like when they're crying. Signs that it may be an infection though is that the eyelid will look red or puffy, or there's a lot of mucus that's a different color, like yellow or whitish. If you do see signs of puffiness, discomfort of the eye, or a lot of mucus coming out of one eye, that could be a sign of an infection. You should definitely go see your eye doctor right away. Another common eye problem in babies is that on occasion, babies have very high prescriptions. They may not be as visually attentive or may not quite make as much eye contact because it might be very blurry for them. An infant exam will usually reveal if the baby has an unusually high prescription. We've had babies before where they came in for an eye exam and had an unusually high prescription, and when they put on the glasses on the baby for the first time, they looked straight at their mother's face and smiled. Those are the best moments. But if we didn't prescribe glasses for these young babies, their vision development, motor development, and even cognitive development of like reaching for objects may have been delayed because they couldn't see. Lastly, you may see your baby's eyes crossing. Now, let's say that your baby is between 6 months and 1 year of age, and on occasion you see the eyes cross in a little bit, or they may kind of wander all over the place because they're not really sure where to look. Tracking skills develop within the first year of life. If it's just an occasional cross of the eyes, that a lot of times can self-resolve. What you don't want to see is a permanent crossing or a permanent wandering outward of one eye where the eye doesn't come back to the straight position. Take a look out for this. We call this condition strabismus, and it can show up early after birth within the first few years of life. Strabismus, if it's what we call intermittent, which means it happens just some of the time, a lot of times can be trained with observation or exercises like vision therapy. But if the strabismus is constant, we are concerned because we don't want that eye to develop decreased vision. If you do see your baby's eyes not aligned and you see it more often, bring them in for an eye exam right away. Let's talk about some dangerous symptoms that you might see in your baby's vision that would indicate that you need to take your baby in to get their vision checked right away. If the baby is not making direct eye contact with a person and their face, it could be an indication of loss of vision or poor vision, or maybe even something not connecting between the eyes and the brain. Looking at a person's eyes or face is one of the first targets that a baby will focus on, such as their mother singing to them or talking to them while they might be nursing. This is how babies develop social skills. If the baby is showing a lack of eye contact, it might be an indication of a social condition, or it could be an indication of a visual pathway that maybe they are not able to see the mother's face or not visually connecting that image with what their brain is processing. We also want to be able to check the retina and the nerve of the eye, such as in babies that are born premature. There is a condition called retinopathy of prematurity where the retina is not fully developed. These are things that should be checked early on if your baby was born prematurely. Next, shaking of the eyes. If you look at your baby's eyes and you see them quivering like this, side to side, this is a condition that we call nystagmus. Nystagmus looks like dancing eyes, but nystagmus can be congenital, meaning born with it, but it could also be coexisting with other medical conditions. So absolutely get your baby's eyes checked right away if you see them shaking or moving side to side. Lastly, if your baby gazes aimlessly at lights, if you feel like they're not engaging with the world, or like when you show them toys or talk to them, they're not searching around looking for the target, but just kind of aimlessly gazing up, and they seem to be fixated on bright lights, this could be an indication of vision loss or also of neurological conditions. If you happen to notice any of these symptoms in your baby, please bring them into your doctor right away and have it looked into. Vision development is so important. If you want to learn more about infant vision, check out our website at insightvisionoc.com and bring your baby in for an infant eye exam so we can check to make sure their eyes are nice and healthy. Thanks, and see you again next time.